Hey everybody, this is Peter Burehouse. I'm out in Seattle and at the Academy Health meeting, the annual research meeting, and guess who I ran into? It's Hilary Barnes, and you just saw the Health Affairs. It's the current issue of Health Affairs, and right on the front cover is an article that Hilary is the first author on, and it's about rural and non-rural location of nurse practitioners. So Hilary has agreed to take a few minutes and talk about her study. So Hilary, thank you very much for taking the time.
You're welcome. Thank
It's
you.
Good to see you again.
Nice to see you.
And I wanted to just sort of ask you, what was the main idea of the paper? What was the purpose of the paper?
Well, we had this longitudinal data set, and we wanted to look at employment trends of nurse practitioners in primary care practices, looking at rural and non-rural settings. It's an important study, important topic to look at now with a lot of policy changes and population changes requiring increased access and quality care to primary care. So we wanted to look at to see how and if practices are employing nurse practitioners.
What data did you use?
We use the SKNA data, which is a practice level data set of physician practices. It's national in scope, and you can identify individual providers within that practice. So we're able to look at trends of physicians and nurse practitioners and physician assistants in that data set.
Wow, have you used this data set before?
Yes, I conducted a cross-sectional study published in Medical Care Research and Review looking at NPs working in primary care based on scope of practice. And in that study, we found greater presence of NPs working in primary care in full scope of practice states or where NPs can practice independently.
And that was published in Medical Care Research and Review?
Yep, in 2017.
Okay, good. I'll have to look at that one. Perfect. So back to this study published in Health Affairs. So you used the SKNA data. What were the main results that you found?
We found increasing presence of NPs in primary care, and these physician practices are evolving to incorporate more NPs. We found that by 2016, so we looked at data from 2008 to 2016, and by 2016, 25% of providers in rural primary care practices were nurse practitioners. And that was an increase of about over 40% in the presence of NPs in these practices.
Wow. So big increases.
Big increase. And at the same time, we saw a slight decrease of physicians in the proportion of primary care providers.
Okay, great. Was there anything that surprised you in this study?
Yes, we also looked at the data across scope of practice. So we categorized our states into 3 levels of scope of practice: independent to kind of a moderate, reduced scope of practice to restricted states. And we actually found the greatest growth happening in the reduced scope of practice states, the fastest growth. But practices in full scope of practice states were the states that were the practices that had the most NPs in them.
So more NPs in the open states,
right,
but stronger growth in the restricted states.
Right, in this kind of middle category restricted state, exactly.
Okay. Good. Any reasons why, you think?
We think for a couple reasons. We think that in these reduced scope of practice states, the NP needs to be collaborating with a physician legally based off the legislation, but they have a lot of leeway, and they can do a lot more in these practices, in these states, than say in the most restrictive states. So we think they have very high value to these practices and really can contribute to efficiency, lower costs, and access for patient care.
Great. Hilary, anything else?
No, thank you very much.
All right.
I appreciate talking to you.
Great. Thank you so much for taking the time.
Yeah, my pleasure.
Bye-bye.
Bye.